Good evening. My name is David Bakelman, and I am the CEO of the National Pancreas Foundation. I wanted to welcome our distinguished speakers, as well as our audience, patients, medical professionals, caregivers, and families to our live webinar tonight titled Patient Resources for Pancreas Disease and After Diagnosis. Our webinar tonight is being hosted by the National Pancreas Foundation with our Black African American initiative, as well as our partnership with the National Minority Health Association. Through this educational webinar, you will gain knowledge from experts on empowering the Black African American community, how to speak about illness, self-care, patient resources, and advocacy and support. It's my pleasure to introduce our moderator, Dr. Darwin Conwell, Professor and Chair at the Department of Internal Medicine, University of Kentucky College of Medicine. Dr. Conwell.
Thank you very much, David. I'd like to just also add my welcome to everyone that is tuning in tonight on this webinar. We are thankful that you are here. We are looking to share a lot of information with you, whether you are a caregiver or you are a patient with pancreatic disorders such as acute or chronic pancreatitis or pancreas cancer. This is a time for us really to engage you, educate you about this, and empower you and give you more information on these disorders, and really focus on the Black and African American community. Our first webinar, we talked a lot about risk factors and the reason why we have a higher rate of pancreatitis and pancreatic disease in the Black community based on some of the social determinants of health, and also risk factors such as diabetes and obesity and smoking and alcohol. So we're going to now start with our first speaker, which is Congresswoman Robin Bailey. Congresswoman Kelly could not be with us tonight, but wanted to say a few words on the importance of the African American Initiative and the impact and the importance of it in the Black community. Congresswoman Robin Kelly has dedicated her career to public service. Her work has expanded economic opportunity, community wellness, and public safety across the state. She's been championing numerous initiatives to generate job growth, reduce health disparities, and end gun violence. She's also worked to focus on expanding access to healthcare, consumer protection for American families, and economic development. She is the Vice Chair of the Energy and Commerce Committee, Chair of the Congressional Black Caucus Health Brain Trust, and co-chairs the Congressional Caucus on Black Women and Girls. She also co-chairs the House Democratic Policy Group and House Tech Accountability Caucus. Please welcome Congresswoman Robin Kelly.
Thank you for inviting me to join you tonight to kick off this webinar. My name is Congresswoman Robin Kelly, and I represent the 2nd Congressional District of Illinois. I am also proud to chair the Congressional Black Caucus Health Brain Trust. As a legislator, I work tirelessly with my colleagues to address health disparities and promote health equity. This includes leading efforts to improve maternal health outcomes, as well as championing the legislation like the NIH Clinical Trial Diversity Act to ensure underrepresented populations can participate in clinical trials that shape the way patients are cared for. I welcome the opportunity to work with leading healthcare providers such as Dr. Darwin Conwell, who will be speaking tonight, and national organizations like the National Pancreas Foundation to address disparities and barriers to access treatment for pancreatic cancer and pancreatitis. The African American community remains 3 to 4 times more likely to develop pancreatic cancer or pancreatitis and have disproportionately high mortality rates from this condition. Improving awareness, access, and clinical trial participation will help address the persistent problem. Together, we can lower these rates and improve health outcomes. Last Congress, we were able to get so much done to improve outcomes and promote equity in the healthcare space. I was proud to champion increased access to maternal health care through the Bipartisan Maternal Health Quality Improvement Act and the extension of Medicaid postpartum coverage to 1 full year. Democrats did so much to lower costs, increase access, and build critical infrastructure to care for patients who have been historically marginalized by the healthcare system. There is so much progress left to be made. I am confident that my House colleagues and I will be able to make even greater strides to promote health equity this year. Thank you again for your time.
Thank you, Congresswoman Robin Kelly, for that inspirational message and your advocacy for Black African Americans with pancreatic disorders. Our next speaker is Mr. Burgess Harrison. He's the Executive Director of the National Minority Health Association that's co-sponsoring this event tonight, and we just cannot thank them enough for their advocacy and helping us in this event, in this webinar. He has extensive industry experience in areas such as home care technology, telehealth, and telecommunications. In pursuit of their goal of achieving health equity for all, the NMHA is currently developing innovative solutions like Equityville, a transitional metaverse, and Operation Healthy You, a mobile app. Mr. Burgess holds an MBA from the University of New Haven and a Diversity, Equity, and Inclusion certificate from the University of Southern Florida. He was also recently honored as a notable executive in diversity, equity, and inclusion by Twin Cities Business Magazine. Join me in welcoming the NMHA Executive Director, Mr. Burgess Harrison. Thank you.
Thank you, and I want to thank the NPF for putting on this wonderful session, and also just, as I just kind of think about it, my connection with pancreatic cancer is my mother, almost 20 years ago passed from pancreatic cancer, and back then there really wasn't a lot of information. We talked today about awareness, and there really just wasn't any. And as a family, there just weren't a lot of resources to tap into and reach out to, let alone anything specific relative to the Black community. So webinars like this that the NPF is putting on, and other informational tools that are available really will do so much for early detection, which is one of the keys in order to fighting this. Without that awareness, it's just not going to get detected. So at the National Minority Health Association, we're all about health equity. And our belief is that health equity is providing the awareness, access, and means so that everyone, and I underscore everyone, has the ability and opportunity to achieve their best and optimal health care and health outcome. And so again, sessions like this will be helpful in terms of providing that awareness that's necessary for anyone who may have been impacted by this, whether directly or someone within your family, at least knows where to go to get more information. And it's some of the tools that we're creating and deploying. Our Operation Healthy You is a mobile app that will work with you to identify your goals for your health, and then curate applications and support services to help you achieve those goals. And we'll be working with corporations and federally qualified health centers to roll that out. And then our Equityville, which is what we call our transitional metaverse. The metaverse will be here with augmented reality and virtual spaces and 3D and so on, but it's not going to be here tomorrow. And we want to be sure that the digital divide that already exists doesn't get increased as these new technologies come online. So we're trying to deploy tools today so that all communities, and in particular underserved communities, have the ability to acclimate themselves in a way that's interesting, informative, and educational in order to bring them into these new technologies. And we know that AI and will be a big part of healthcare. And we want to be sure that, again, underserved communities have the understanding and access to what's good about AI, and also the biases that exist and what to do in order to help combat those. So again, my hat's off to the NPF and all of the speakers today on the panel, and appreciate all the good work that's being done to raise awareness of the issue of pancreatic cancer.
Thank you, Mr. Burgess. And again, we appreciate your advocacy. We appreciate your organization helping us spread the word on pancreatic disorders in the Black and African American community. I'm Darwin Conwell, and I'm going to be sharing a few information slides with you to kind of set further the stage for our panel that I'll be introducing to you later. Can we see the slides? One of the panelists give me a hands up just to make sure. Great. So this is, the NPF Centers of Excellence resources and care coordination upon diagnosis. So again, the National Minority Health Association and the National Pancreas Foundation is sponsoring this webinar to educate you on pancreatic disorders. Again, patient resources for pancreas disease after a diagnosis. There's a free DigiReach download that really gives a lot of information. It's packed with data on Black African Americans that have pancreatic disorders. Many studies suggest that environmental and socioeconomic factors have contributed to the increased risk of pancreatic disease among African Americans. Risk factors include genetics, cigarette smoking, type 2 diabetes, and obesity. The National Pancreas Foundation's Black African American Initiative will address these issues with the hope of decreasing the incidence of pancreatic disease in the Black African American community. Our first webinar in this was on the risk factors and defining acute and chronic pancreatitis. And tonight we have the privilege of being able to talk to loved ones, patients, caregivers of patients with pancreatic disorders, and they will share their experience with us. We want you to spread the word about pancreatic disease in the Black and African American community, and that can be done through churches, community centers, schools, festivals, community health fairs, and webinars just like this. The National Minority Health Association, we want to thank Mr. Burgess for talking with us. I went to their website and there's a wonderful quote from Nelson Mandela. Health cannot be a question of income. It is a fundamental human right. So you've been diagnosed with a pancreatic disorder, acute or chronic pancreatitis, pancreas cancer, or your loved one has been diagnosed with this. What's next? What do you do? And that's what tonight is about. We're going to give you some basic information and let you hear from the loved ones, caregivers, and patients who have been diagnosed and had to treat and go through their pancreas disorder diagnosis. I want to alert you to expert care across the United States. The National Pancreas Foundation has a rigorous criteria to select centers of excellence for pancreatic disease. There's a 164 centers of excellence in the United States, and you can see the purple colored states are those that have a National Pancreas Foundation Center of Excellence. And for complicated cases of acute pancreatitis and the latest in research and technology and quality of care to give you the best outcomes, we recommend you to seek out one of these centers of excellence when your doctors are scratching their head and they need help, or if you have questions, you can call the National Pancreas Foundation and you'll be connected with someone who can get you to a center or get your questions answered by one of the directors at one of these centers of excellence in the United States. So the National Pancreas Foundation Centers of Excellence are a premier healthcare facility that focuses on multidisciplinary treatment of pancreatic disease. It treats the whole patient, focuses on the best possible outcomes for you or your loved one, and improve quality of life. The MPF centers will have pancreas experienced providers, and we will describe the long list of providers that have to be at National Pancreas Foundation Centers of Excellence to meet those criteria. MPF centers also treat the patient beyond the diagnosis with other support infrastructure that may be needed for you and your loved one, and we will talk about that tonight also. Well, your healthcare journey begins with your diagnosis of a pancreatic disorder. So what providers will you encounter on your healthcare journey? Well, of course, a gastroenterologist. If you have cancer, you may have to see an oncologist, surgeons if you need to have a surgical procedure, endoscopy, where a tube may be inserted into your GI tract to help make a diagnosis or treat your pancreatitis. Endocrinologists are very important for us for diabetes care. There's an association of diabetes with both acute and chronic pancreatitis and pancreas cancer. We also know that diabetes also increases your risk of pancreatic disorder. So it's very important that we understand diabetes and whether or not you have diabetes and you get the appropriate care. You may see an emergency room physician, of course, when you come to the hospital with your loved one or yourself. Symptoms usually are nausea, vomiting, abdominal pain in patients with acute or chronic pancreatitis, weight loss, new onset diabetes. Sometimes you don't have any symptoms, and sometimes the disease is diagnosed accidentally. And we'll talk to our panel tonight, and they will tell you how diseases was diagnosed in their situation. If your disease is severe while you're in the hospital, you may have to go to the intensive care unit and receive care by an intensivist or intensive care specialist. Radiologists are critical to our care of patients with pancreatic disorders. CAT scans, MRI scans are routinely done for the evaluation, diagnosis, and follow-up of patients with pancreatic diseases. And of course, probably the most important person you'll have that'll spend the most time with you in the hospital is your nurse. So the nursing staff is critical and connects all the dots for our patients in the hospital with pancreatic disorders. Other things are going to be needed though. Resources and care coordination. And the first thing I listed here was a patient navigator. Some centers will have a navigator for our patients to contact, and a navigator will do just that. They'll help you navigate the complexities of a medical system. Social workers, support groups may be needed. Genetic counselor, I bolded this because we're going to talk more about this from our panel and the importance of genetic screening in certain cases. Palliative care, smoking cessation programs if you are a smoker, alcohol cessation if you are drinking too much alcohol and that may have precipitated your pancreatitis, dietitian, nutritionist, psychological support, psychosocial support, integrative medicine, pain management, and financial counselors may be needed if you're running into difficulties paying for your treatment. I want to focus on some of these resources that I talked about. Genetic counseling. So genetic counselors are especially trained in medical genetics in order to provide a complete review of your medical and family history. They are best to evaluate your risks at developing pancreas cancer or determining whether or not you have a hereditary cancer syndrome or a high-risk mutation that may predispose you to pancreas cancer or pancreatitis. I've listed the PRECEDE study, which is the Pancreas Cancer Early Detection Consortium at NYU Langone. This is an international group that is a longitudinal study of patients that have high risk for pancreas cancer, and it will be worthwhile to contact them if you have a genetic disorder and you want further information on screening and follow-up long-term. There's also other centers such as Johns Hopkins that has the CAPS study that's been going on for a long time, and they also follow patients with a genetic predisposition for pancreas cancer. Support services, I do want to talk about financial counseling because patients with cancer, patients with pancreatitis can get into what we call financial toxicity, where it's really difficult for you to pay for your medications. Some of the medications you are going to be placed on are very expensive, and you may not be able to afford to pay for those. Or if you have cancer and you need chemo radiation, it may be hard for you to get to those appointments, and you may need some transportation or some help to get there. So it'll be very important to get financial assistance, contact social services at your institution to see if they can provide some assistance for you to get the care that you need and the care that you deserve. I do want to mention integrative medicine and health. They may use a combination of traditional and complementary medical therapies and practices such as aromatherapy, yoga, biofeedback, acupuncture, massage therapy, and other services to treat the whole person, mind, body, and spirit. And what we have here is a photomicrograph of the integrative medicine program at the University of Kentucky. And you can see the mats there for exercising and relaxing. Other support services, it's very important that nutritional counseling come into play for your pancreatic disorder. As I mentioned before, diabetes, we have to be on the lookout for diabetes during your hospitalization with acute or chronic pancreatitis, or at follow-up, because you may develop diabetes later at home after your pancreatitis has resolved. And we know up to 20 to 25% of patients with acute pancreatitis can develop diabetes after their pancreatitis episode. Chronic pancreatitis predispose you to diabetes, and diabetes also may be an early marker for some patients that have pancreas cancer. So nutritional therapy, endocrine therapy, a healthy diet is very, very important. Social workers, of course, are extremely important for you for emotional support, counseling, and to help you with things such as temporary lodging that may be available at some centers, and transportation assistance during your treatment. Feel free to reach out to your center and get help that you need. This is a family recipe cookbook for pancreatic disorders, sponsored by the National Pancreas Foundation. There are a lot of downloads for this cookbook. You can go to the NPF website and get that cookbook and use the healthy recipes for your diet and nutrition to help you in your journey in pancreatic diseases. Physical medicine and rehabilitation can help patients manage physical impairments and can oversee personalized rehabilitation programs if you become deconditioned from long periods in the hospital, or if you have pancreas cancer or some other disability. Support groups, there are a lot of support groups online. Most medical centers will have support groups or contact information for other patients and families suffering with pancreatic disorders, and you will provide a lot of networking and just support for your condition and psychosocial care. Other things that may be provided to you will include head coverings and prosthetics and other accessories that you may need for your treatment. Most NPF centers have a cancer center, and this is the Marquee Cancer Center at UK Healthcare. It's an NCI designated cancer center with all the latest clinical trials and support systems in place to help our patients on their pancreatic disease journey. Happy to say that our center has recently been named an NPF Center of Excellence, and this is Dr. Sam Mardini, who is the director of our advanced endoscopy, and Don Baker, who is our research program manager, that put the whole program together in terms of gathering all the data for us to apply for this Center of Excellence. So we want to thank Dawn for her wonderful help, and also Dr. Mardini for helping us from the GI side and advanced endoscopy side for gathering data to meet the requirements to be a Center of Excellence and join this elite group. There are famous African Americans in the Black community who have died from pancreas cancer: Aretha Franklin, Dizzy Gillespie, and of course the late John Lewis. There are community partnerships. You may want to join some of these. There may be a 5K or a walk or a fundraiser that you may want to get involved in to help fight pancreas cancer and provide research funding for scientists, basic scientists, and translational researchers who are studying pancreatic cancer and pancreatic diseases. Again, there's a free DigiReach download packed full of information for you to understand pancreatic disease from the National Pancreas Foundation website, pancreasfoundation.org. I like this quote from John Lewis: "If not us, then who? If not now, then when?" Thank you very much. Okay, we're going to ask our panelists to turn on their video so we can see you, and I'm going to introduce our panelists. And our panelists is composed of caregivers, patients, and we really want to thank our patients for sharing their story with us, and the caregivers for also sharing their journey. And this is a time we're going to have we have some set questions that we're going to ask them, but we want them to tell their story. We want them to really educate us and empower us to go get the help that we need for your loved one or for yourself in your pancreatic disease journey. So I'm going to have Ramon Robinson and Nicole Owens introduce themselves.
Certainly. I am Ramon Robinson. I lost my mother to pancreatic cancer in 2015, but she was first diagnosed a little over 4 years earlier and first became symptomatic 5 years earlier. And I also lost my grandmother on my father's side of the family to the disease in 2004, respectively at ages 96 and 63.
Nicole, you are muted. You're still muted. Okay, sorry. There we go. Now try it again. Okay, now unmute. Now. Yeah, I'm sorry, you're still muted. We'll have to work on that. Let's move on to Verna Jackson. Verna?
Yes, my name is Verna Jackson. I'm pancreatic cancer survivor. I was diagnosed in 2021. They was looking for something else because I had severe pains in my stomach. And they ended up and found that I had the cancer. So I had to have surgery. Hello, you hear me?
We can hear you,
Yes.
Verna, yes.
Oh, I ended up having surgery. They took 50% of my pancreas and they took my spleen out. And it left me like a diabetic, taking insulin 4 times a day. And then I have cataracts, both my eyes, glaucoma. And, you know, I made it through. It was hard, but
Amen.
With the help of God, I just kept on trying. I refused to give up. And I just found out Tuesday that I have cancer came back, is in a line in my stomach. So I have to go for another PET scan. But they say it's treatable. So I'm happy about that.
All right, great. Thank you, Verna. We're going to be coming back to you, but I just want to say from all of us, thank you for sharing your story with us, and we're looking forward to hearing more. As I said before, you were diagnosed in 2021, and you're still here, and that gives a lot of us hope. And you heard earlier from Ramon, mother passed from cancer, but 4 years. And that's going to give us all a lot of hope, because when you get diagnosed with pancreas cancer, you're wondering, am I going to make it to the next birthday, holiday, family reunion? Am I going to see the new year? And to have people who can tell us about 4-year, 5-year survival, it gives us a lot of encouragement to go through the difficult treatments and the surgeries, because there's hope for you. Rashaunda Shaw. You're muted, Rashaunda. Just unmute yourself. Yeah.
Got it. Good evening, everyone. Thank you for joining us for this very important webinar. My name is Rashaunda Shaw. I was a caregiver for my mom, who passed away from pancreatitis, as it was described to our family as acute pancreatitis at the age of 64. She was hospitalized from February 23rd, 2019, and passed on March 18th, 2019. So I'm just prefacing that with a timeline just to give you how quick the turnaround was for my mom's passing and transition.
Okay, thank you, Rashaunda. We're looking forward to hearing more from you, because your mother had pancreatitis, and most patients, you know, over 80% of patients, 85% of patients do not have difficulties that your mother had and do not pass away from pancreatitis. So this is, we want to hear more about your journey and your story to help others. That there are some things that you now know that you would like to tell us. If someone's starting to experience this in their family, you can educate us on that. Jennifer Jones, Mrs. Jones, if you can.
Hi.
Yes.
Hi, everybody. I'm so glad
Hi.
we're doing this, and thanks for everyone else who's joined in. I am 37 years old, and I was initially diagnosed with pancreatitis when I was about 9 or 10 years old. I was diagnosed with pancreas divisum, as well as having a genetic component with that.
Thank you very much. There actually is a national study sponsored by the NIH called the SHARP trial that's looking at pancreas divisum as a cause of recurrent acute pancreatitis. And of course, genetics is very important in terms of predisposing some patients based on the genetic mutation to recurrent pancreatitis and pancreas cancer. So we're looking forward to hearing more about genetic testing because several people here have talked about that, and you can educate us all on your genetic testing and what that was like. So let's move into some questions for our panel. I do want to tell everyone on the Zoom call, if you do have a comment or a question, feel free to enter it into the Q&A box, and we'll be able to see that, and we'll try to get to your question. So I'm going to start off with some questions for our panelists. And remember, symptoms, you may have no symptoms and get diagnosed with pancreas cancer. Pancreatitis, on the other hand, usually there's nausea, vomiting, abdominal pain, weight loss. So there usually are some symptoms with that. So I have a question for the caregivers, Rashaunda, Ramon, and Nicole. What resources did you reach out to? And what resources do you wish you would have known about that you found helpful later? So what resources did you use, and what resources did you later find out about, and how would you educate someone who's going to be doing this journey? Ramon, yes, go right ahead.
Sure. Ways into our mother's journey, I reached out to the Clinical Trial Matching Service at the Pancreatic Cancer Action Network. And my contact there, Emily Lyons, quickly became a resource on a variety of different issues, including identifying other doctors, identifying potential natural treatments, how to talk to my mother about what she was experiencing. It was really quite amazing how much she knew and how much she was willing to do that she didn't have to do. I also used the Cancer Compass Forum, which at the time, and probably still now, was very active with survivors of the disease and caregivers. They were very frank about what they were going through and very willing to be responsive in a timely fashion to questions about what we were going through. And then lastly, my sister, who will speak next, identified some survivors who could speak to our mother on the phone directly, very frequently, and they became her champions virtually, and important resources to us as well.
That's
and
awesome.
Nicole will tell more about them.
Nicole?
Hi, are you able to hear me now?
Yes, we got you. Thank you.
All right, wonderful. Thank you. Yeah, so my brothers seem to do a pretty good job of covering the extent of the resources. I will say that seemed to be kind of a turnaround opportunity for my mother's mental processing of the disease. She was very private about what she was going through initially, and even tried to not share it with us. But as we learn things, she's a very strong woman. Didn't really let on her concerns or her fears. But we identified some caregivers through Cancer Treatment Center of America. They have a website that speaks more to the survivors, right? And so I focused on the positive stories, and we were able to connect her with a couple of folks that really inspired her, and I think gave her more will to fight.
Awesome. We really appreciate that. Rashaunda.
Yeah, so our
resources.
Our situation was slightly different with my mother. Her onset of pancreatitis was rather sudden, and we relied solely on the hospital that was treating her at the time. It wasn't until after my mom had actually passed away that we realized that the hospital that she was being treated by was actually one of the 164 NPF centers affiliated with one of the centers in Manhattan. So we, at that time, felt like it was a missed opportunity for the doctors to, have reached out to Cornell Weil to find out, would it be possible to transfer our mom there instead of referring her to a subacute rehab. So we did not really come across, we relied on our educational background in terms of pancreatitis. We knew itis means that, you know, something is inflamed, and it happened to be her pancreas. But it was a missed opportunity for us to actually get her to one of the NPFs that hospital was actually affiliated with. But I know now, so I'm more knowledgeable and have a better toolkit to help others.
Absolutely. So we really appreciate that. So this is, you know, what you know now and that you wish you knew then, right? So I think we're educating people on the resource support services, identifying NPF centers, and hey, doc, should my mom or dad or should my loved one be transferred over to this center because they have some more expertise and more resources that they may not have at that institution. And that's okay to get in a second opinion, right? So Ramon and Nicole, what do you know now that you wish you knew then? Anything?
For me, I would say there's a few things. You know, my mother's initial signs before we were rushed to the hospital suddenly, she kept complaining of digestion issues like acid reflux. And she kept saying, you know, I think I just need to take some, you know, drink ginger ale, and she would take Pepsid a lot before that time. I also suffer from GERD issues from a very young age. And so over time, because of my mother's illness, you know, we did a lot of research. We switched facilities and physicians several times, and we felt like, you know, they weren't very hopeful. And so the things that we learned along the way is, you know, like the better diet, which you've spoken to earlier, but also certain types of medicines, whether it's over the counter or prescription, that may not have been as beneficial, like such as the different acid inhibitors and things of that nature. So we learned a lot about spices and herbs and things like that we incorporate in our diet, you know, even today now. So I wish we had been more mindful about those type of things. Growing up, my mother, she was a great cook, but she let us drink Coca-Cola every single day since we were babies. And I wish that I had known to be more mindful about our diet at an earlier age. I would say to answer that question.
But you have the opportunity now, right? And that's what this is about. You can share the information with everybody else. You know, I tell my patients, you don't know, a heart healthy diet, you know, low cholesterol, low fat, get some exercise, sleep, and nutrition. What the military calls the performance triad. Very, very important. So let's move on to some patients. And I really thank Ramon and Nicole for sharing your story with us. Then we'll come back to you more with your mother having pancreas cancer. I think what's really remarkable about her story is 4 to 5 years of pancreas cancer. That gives a lot of us hope. And also just thank Rashaunda for sharing her pancreatitis story with us. Now we're going to move to our patients, and I want to hear from Verna and Jennifer. What's been the best resource for you in your journey? What's been your best resource? Let's start with Jennifer, Mrs. Jones.
Well, personally speaking, I dealt with it. It took them a while to diagnose me officially because I did not have all the typical signs of pancreatitis. So if you would Google the symptoms of pancreatitis, out of the 5, I would have 2. Like, I rarely ever in my life of having pancreatitis for over 20 years have ever thrown up. So, like, you know, they will look at that as like, well, you know, maybe it's something else, you know. So then that would make them do further testing and further, like, so then it became this loop, right? Mm-hmm. But what helped me is my determination and my assertiveness, although also the support of my family, and making, you know, encouraging me to continue to look for and continue to get answers and continue to, you know, ask questions. My reliance on spirituality, my connection to my therapist, my family, just, and then one of the biggest things I learned towards, you know, the end of, like, you know, as I got older, I would say Facebook support groups or other support groups locally, sharing their experiences, because it's nothing more connecting than knowing that there is someone else out there that is experiencing the same thing as you. So you could be in a room of 10 people, at least half or 3 or 4 people will be like, that's me, or that's me too, oh my goodness. And then you feel this connection, right? So that is so encouraging, just hearing that and listening to that. And that keeps you going, at least it did for me. So
awesome. So social media can be very helpful, right? Spirituality. Verna, tell us resources that you tapped into, or what helped, what's getting you through right now?
Well, I ended up, and I had to get me a counselor, to do therapy, because it was so much on my mind, so it's like overwhelming, emotional, physically, mentally, hit me pretty bad. But I'm learning to deal with it, and I talk to my kids and my family, and I said I'm learning to deal with it. It's a hard thing. It's a hard pill to swallow, but you can't swallow it. Just keep trying. And so that's what really got me through, it really it did. Then I had a hospital, through the hospital, I had transportation to
great
do my chemo. I had all the transportation, but got to be careful with that, because they would take me there and leave me, or they would bring me back. They said they couldn't do it both ways because they didn't know how long I was going to be there. So I ended up and got a ride from back and forth from a family member. And I really learned to deal with it. It's a hard thing, but like my family tell me, you've been through so much. You made it through that. You make it through this, and I definitely will. Because whatever happens, you can't control it. Just have to pray and believe and be strong.
All right. We really appreciate you, Verna and Jennifer, sharing your experience, because you are what this is all about. You've got the diseases, and you can tell us a lot and educate us a lot. So this is for everybody. Were there any barriers to care that you remember or still have? One of the big barriers that Verna talks about is transportation. If you're going through chemotherapy and radiation, you're not feeling well, right? And a lot of times you'd rather have your loved one or someone drive you there and come and pick you up. But sometimes that may not happen. And you want to make sure you get that appointment and make that chemotherapy appointment, that radiation therapy appointment. And sometimes there may be a barrier just to getting there and getting home. And that's a real issue. In your hospital, your medical center may have information through social work to help you get the services and transportation that you need. So barriers, it's open for all the panel. Ramon, you've got your hand up, so tell us about some barriers.
Sure, really quickly, just the refusal of many in the medical establishment to consider that anything else could be done, just the insistence that it was a lost cause from the beginning. And then later, when we were able to identify, an oncologist or, other oncologists once she was stage 4, this insistence that natural treatment would not be efficacious at all, and that, either it was chemotherapy or nothing.
Okay. Jennifer, Mrs. Jones?
I would say educating the first responders on, what other symptoms can cause pancreatitis? What are their causes, right? So I wasn't an alcoholic at 9 years old. So at least I don't think so. But, you don't know until you ask more questions. So sometimes it's just about not looking at the surface and just, looking a little bit further into the patient, or maybe asking a little more questions instead of assuming that we know what, is the cause, or we know what's, So those were the barriers. One of the biggest barriers that I encountered was with maybe in the emergency department. But I sense that over time, a lot has happened with educating the nurses and the staff on other things that may be causes of it. And I noticed a change has happened.
That's awesome. That is awesome. But what she is referring to is very common. So as a medical pancreatologist, having done this for over 30 years, a lot of our patients that have recurrent pancreatitis are felt to be alcoholics. Alcohol is a common cause of pancreatitis. So she mentioned first responders. She's referring to the emergency department because it's not uncommon for them to say, well, this is probably a closet drinker, and that's why she's having recurrent pancreatitis, or he's having recurrent pancreatitis. And so they may not believe you. So I had a lot of patients over the years that had to experience that. And they lost trust and faith in the health system because they felt that people were ignoring them and not respecting them. And saying, I'm not drinking. And one of the things that genetic testing does do for you, I used to tell my patients, well, now you're a card-carrying member of a CFTR mutation, all right? So now, or you have a PRSS1 mutation. So when you come to the emergency room, you say, I'm not drinking. Yeah, I have a CFTR mutation that's causing my pancreatitis. Now, there may not be treatment for that mutation, but it does tell the care providers that, hey, I have a real cause for pancreatitis. Now, there are groups of patients that have what we call idiopathic pancreatitis where we don't know the cause, and that's just the way it is. As technology improves, that group is getting smaller because genetic testing is starting to uncover some mutations that we didn't know about 20 or 25 years ago that we're now discovering are cofactors in predisposing patients to pancreatitis. So thank you for that. That's real important. Anyone else?
Oh, yes, I had my hand up. That was just to piggyback off of what Jennifer pointed out. We kept getting that recurring question as well in the emergency room. Is your mom, does she drink? And each physician who kept coming to us to get more medical history and asking us questions, we were like, no, she's a type 2 diabetic. We know that she's overweight. We know that she has high blood pressure. We brought all the medications to the hospital with us so that they would know, what types of medication she was taking at that time. So those were some of the comorbidities and risk factors that Dr. Conwell spoke about earlier. That my mother was experiencing at the time that she was hospitalized. Another area or barrier for us was, having her referred to a subacute rehab, which was not equipped, in our opinion, to handle pancreatitis, because we now realized at the time that she was released from the hospital that her pancreatitis had not resolved. So just, educating the social workers, making sure that you advocate for family team meetings, just to be clear about what is the next step and course of action for your loved one.
That's awesome. Really appreciate that. Okay. This is for everyone. So why is family history important? And how do we talk to family about medical history? So this gets into some of the genetics and testing. Some of you have been tested. I want to hear more about that in terms of why is family history important. So Nicole, you all have experienced this with your mom and also family members also that had pancreas cancer. So that raises a question, right? It's a red flag for you all and your children and your whole family. You want to tell us about that?
Yes, well, actually, I think my brother, Ramon, is probably better equipped with that one. Ramon, I believe you followed up on some genetic testing, right?
I did do genetic testing just 3 months after our mother passed away in April of 2015. And, let me tell you, though they did not determine that any of us had a gene that would lead to pancreatic cancer, they mapped our whole family history and were able to identify other relatives and other branches of the family who might have cause for breast cancer or other neurological diseases. So, it is helpful to get genetic testing, not just for your immediate experience, but also for the people around you who are relatives of yours. or it can be at least.
Right. So, Mrs. Jones, tell us about genetic testing, and for you, when did that occur in your pancreatitis journey, and what was it like?
So with having pancreatitis as it being an autoimmune condition, I went through a period of remission, and when it did return, they did genetic testing, and it came back negative. However, some months or a year or two later, my older sister, we are 5 years apart, and she went into the hospital, and she had a severe bout of acute pancreatitis, and they tested her, and she tested positive. So which is really, it's interesting, you know, I mean, I think they are evolving with the testing, but obviously there is some familiarity with the genetics there. We also have, and just to add to this, we have, there's 8 of us, and at least 4 of us have Crohn's disease. And so there's the genetics are there. It's definitely there.
Yes.
So it just basically, it just goes to show you just don't give up. Even if you are by yourself and you feel alone and you feel like no one is listening or you're not being heard, maybe you need to approach it a different way. You know, it just takes perseverance and patience and just support of people outside of the hospital to help you keep going, because you're going to get the answers you need. It just takes time.
Thank you very much for that. Anyone else, any other comments on genetic testing? Okay, great. You know, there are some mutations, some patients that get breast cancer, and some of the breast cancer mutations and some of the mutations help guide therapy for the breast cancer, but also some known breast cancer mutations can predispose you to pancreas cancer. And so that it's known. And so it's not uncommon for our cancer centers or our medical pancreatology clinics to have referrals for patients that have like a BRCA2 breast cancer mutation, because that predisposes you to pancreas cancer, and you need to be screened and evaluated with genetic testing and also with surveillance strategies in terms of endoscopic ultrasound you may have heard of, MRI scans, and these things may be alternated to try to make sure there's earlier detection if you do have some changes in your pancreas that looks like early pancreas cancer. So how can friends and family help support the patient and caregiver? What about the caregiver? What kind of support would you like to have, or did you wish you had, or what would you suggest the people who are caring for a loved one with pancreas cancer or recurrent pancreatitis or is sick? Jennifer?
No.
That wasn't you. Okay. Ramon?
Wait a minute.
Yeah.
Yeah, you know, I mean, just being willing to listen to somebody really vent and rant, you know, that is the key. It's a very stressful experience, and, you know, not coddling the person or telling them to think about it differently, just listening and, you know, letting the person, the caregiver unload on you, because it is really, really tough. And, you know, one of the things about having dealt with the disease for a number of years is while her survival was very impressive, you know, it meant that we were all extremely stressed for many years. And we needed all kinds of therapy as a result of that.
Appreciate that. Verna, what do you think about this in regard to your family? What do you think your family needs? What would you like to tell others who have family members who are observing their loved one with cancer? What kind of information, or what would you tell them? I think her screen is locked. Nicole?
Yes, I was just going to piggyback onto what my brother had mentioned. Definitely an outlet. because my mother chose to be private, we had to respect that. And so we really had each other, 4 of us. We have 2 younger sisters. I was having my children, starting my own family at the same time that the disease occurred, or onset. So having someone else take care of you, help make, meals and things of that nature. So in a situation where folks are aware, I do respect and understand my mother's decision to keep things private, because, when people suspected that she was sick, they would automatically just kind of have a negative outlook. But if you have family or friends that are around that can remain positive, minded with you, but realistic in terms of seeking information and helping you do research and make calls for, different resources and things of that nature. Looking back, that would have been something I would have liked to have had. But I'm happy that my siblings and I had one another do that.
Okay, awesome. All right, Jennifer.
Just more understanding from friends, not so much from family. I felt like, in all honesty, being totally transparent, I really felt like throughout my transition of trying to understand the disease myself, I lost some friendships because they were not understanding of the care that was needed, or, even if you're a caregiver, like the care that was needed for your mother or your sibling, or just for you. Like, one minute you may feel okay, and the next minute you eat something and, everything, changes. So it's just different. It's night and day difference. And they are used to you just like being available, to go out or to go somewhere, or just to be there. But just understanding and being patient, that things will, and they'll, that's the most I could say, because like my real friends are still there, but the ones that were like surface, they just, that it didn't last long. So it's disappointing, but it did show me
who really cared about you and who was really with you through the thick and thin, right? Okay. Awesome. Great. So for those of you who have lost loved ones, how do you honor their memory? How do you honor their memory?
Well, Dr. Conwell, this is Rashaunda. We have done several things since becoming involved with the National Pancreatic Foundation, one of which is participating in the Pancreas Bowl. So we've done our second Pancreas Bowl this year, and we will continue to raise funds through the Pancreas Bowl and increase our awareness and increase the number of people who are coming out and fundraising. I just think that in the African American community, it's not a topic of discussion, so to speak. And so our goal right now is just raising more awareness. We've also been making sure that we actually started our own nonprofit because we had another loss with my sister. So we have our own nonprofit, and we are looking to continue to partner with the National Pancreatic Foundation, working through our church in Brooklyn, New York, with our pastor, David Kelly, who has like Transition Tuesdays within our African-American church. So we're just trying different things to get the word out and connecting NPF throughout our travels in New York City here.
I mean, getting involved, getting engaged, helping others, fundraising, and these are not like, you don't need to raise $1 million. You need to get out there. Everything counts. Everything helps. Every penny helps. For transportation, getting an Uber, whatever it takes to get to the hospital, get the chemotherapy or treatment that you need. In the National Pancreas Foundation, a lot of the funds also go to educating young people. They've got the largest number of physicians, young junior faculty, going to their fellow symposium this year. I think they told me it's over like 100 applicants. So So that's great. So there'll be more and more doctors who understand pancreatitis and not accusing loved ones of being closet alcoholics, and being able to say, you know what, recognize your limitations. You know, we need to get this patient to a center of excellence because we don't have all the resources that they need, and that's okay to do that. So appreciate that. Nicole, you're muted again. There you go.
Yes. So my brother will probably elaborate. He's been heavily involved with PanCan and other things. We did do some fundraising activities, done walks and things of that nature. We were fortunate enough to collect enough funds. And my mother was a general contractor certified minority women-owned business owner. And so we were able to partner with the Chicago community colleges and provide scholarships to men and women in the trades through a scholarship in her name. So that really one way, but every year, annually, some of us participate in walks and ask friends to do the same in their cities at the same time.
Okay. Ramon?
Yeah, I mean, to my sister's point, I co-chair the Purple Stride in Chicago. I've been doing that since 2016, so I'm going on my 6th or 7th or 8th year of doing that. I also go to DC and I advocate in person with our senators and our Congress people, including Congressman Robin Kelly, who spoke earlier today, and the assistant of Bobby Rush and many others. And then lastly, I wear a purple hoodie that's on the Pancreatic Cancer Action Network pretty much everywhere I go when it's spring or winter weather. And I get all sorts of questions at movie theaters, on the train, on the street, in restaurants, in other countries, Iceland, Germany, and everywhere around the world where they see that and they see a potential kinship.
That's awesome. Appreciate that. That is great. Okay, so we've talked about advocacy. National Pancreas Foundation has been mentioned. PanCan, Purple Stride. I think those groups are wonderful to get involved in. Anything else you would like to tell those on the Zoom call that we have not mentioned here yet?
I would just like to mention, Dr. Conwell, just making sure that your faith is at the center of everything. I know that all of the panelists have spoken about our faith, and just making sure that you reach out to your spiritual leader, your pastor, whoever. We did that. My mom was a strong believer, and she wanted our pastor to be there at the hospital praying with her. She made sure she had her last communion. We didn't understand what was going on at that time because we were focused on the positive outcome for her, but she was ready. There was a conversation. It was prayer, consistent prayer. Members from our church continued to come out and pray with my mom. She also had the nurses in the hospital to print out "Victory is Mine" and post it on the wall for her. And we walked in and we were like, "Mom, like, okay."
All right.
So,
We're having church in the hospital room.
Exactly.
But one of the things that's very important is how do you reach different ethnic groups? And for the Black community, it is well known, you got to go to church. You got to go to church. You want to reach the largest number of Black and African Americans in the United States of America, you have got to go to church. You got to get there. That's where a lot of them are. So Verna, give us some thoughts. Share some wisdom with us here.
Let's see. Well, I would say, oh God. When I went through it, it was really rough. I made it through with that for God. And I would say, if I didn't have my family, my kids and whatnot, I think we would have been even harder. But, I had them, they kept, they kept talking to me, tell me they're gonna be all right, which they still tell me, But it is kind of scary knowing that I had this cancer again and out of my stomach. It's kind of scary. But he did say he had it's treatable. Still, it's like I just finished chemo last year in February. Here it become more cancer yet. You know, it's like, wow, overwhelming. Wow.
Yeah.
So, yeah, it left me to a point, like I said, I had to get a therapist, someone to talk to, because it's like a mind thing.
Yeah, several people have said that, and there's nothing wrong with therapy to help get you through it and talk through it and get the psychological and social help that you need. We really appreciate that. I think one of the things I want to come back to, I said at the beginning, is that you know, you were diagnosed in 2021. This is 2023. Exactly. And you know, Ramon and Nicole, you know, your mother lived 4 or 5 years. Had symptoms for 5 years, lived 4 years after, and that that gives a lot of us hope. It gives me hope as a physician, because most of the patients I see don't last that long, but I don't know which one's going to last that long, right? So we got to go for it. Yeah, go for the chemotherapy, radiation treatment, get everything you need to maximize chance of survival. And also with genetic testing, if that is something that you have and is positive, get to a center that is doing a program where they're going to follow you, because early detection is the key for pancreas cancer cure. And I've seen several patients who were in programs that had abnormalities come up, and the scans were negative the year before, but some abnormalities came up. They had genetic predisposition, and they went in, had surgery, and it was cancer, you know, and they are doing very well. So there are a lot of those stories out there too. Anybody else? Yes, Jennifer, go right ahead.
I would say if we could get more people talking about pancreas cancer and pancreas diseases in the community. I just know, like, just talking to my sister, she, you know, outside of myself, you know, there's so many other families that she knows that are African American or Hispanic or, you know, of other marginalized, you know, communities that she's, you know, finding out that are developing, you know, either cancer or pancreatitis. But I'm wondering if it's like, if it's just more of a community part that we need to do, which will spread into mainstream media, or if it's the other way around, like, does it need to be mainstream media and then spread out to get, you know, everyone to feel comfortable to talk about this out loud? Just like mental health, you know, mental health is now becoming more acceptable to talk about out loud. But, you know, this is one of those things that we should talk about out loud more before it enters stage 3 and stage 4, you know, that way you can get the support you need.
Yeah, we greatly appreciate that. And I will say this, that's what this webinar is about. It's recorded. It's going to be on YouTube. You can start sharing it with people. The other thing you can do, my wife Kathy and I have been involved in a lot of community engagement and outreach efforts through churches and community fairs. The National Pancreas Foundation will send you pamphlets for you to set up your own table, all right, and give information to people at a health fair, people at your church. You know, most pastors say absolutely set up a table and talk about this. This is a higher rate in the Black and African American community, and that's what this is all about. This Black African American initiative is getting the word out. There's increased risks. We need to, and a lot of these risks are modifiable. Obesity, smoking, you know, those things can be changed, and not necessarily easily, but we can modify those and have a healthier diet, you know, less fat in our diet and exercise. And so there are some things that we need to educate our community, ourselves about, and our family members about. So does anyone else have any things? I'm going to wrap up. Anyone have any parting comments? Yes, Ramon. You're muted.
One last thing quickly, you know, my mother was not a disease. She was alive for almost 60 years before she became sick. And it's really important to keep conversations going, you know, with your loved one and with those around them about who they really are apart from this and the fullness of their lives and just the totality of their existence. You know, it's important to do that for the person's mental health, for your own mental health. And also, honestly, I think she survived for many years because we did not reduce her to this disease. We talked about, we went on vacations, we kept talking about fun things. We sought pleasurable things to eat when she could eat, and we kept the fun going.
Great. Thank you so much. So I just want to thank all of you on this panel, especially those who have pancreatitis and pancreas cancer. We really thank you, Jennifer. We thank you, Verna, for sharing your story. You're very brave, but you have helped a lot of people tonight. This is going to be on YouTube. It'll be shared and played over and over again. I'm going to be tweeting it on my Twitter page and getting it out there to people so they can hear the story, hear what it's like to have pancreatitis, hear what it's like to have pancreas cancer. I really thank Ramon and Nicole sharing your story about your mom. You know, that's important. She lived 4 years with pancreas cancer, and obviously you took great care of her and loved her very much. And now you're in advocacy to try to spread the message and fundraise and things in her honor, and that's great. So keep her in your mind. And Rashaunda, we thank you for just telling us about your story. And that was obviously not easy to do, but it definitely emphasizes why the National Pancreas Foundation exists, why a panel of experts decided to write down some criteria to help get patients the best treatment they can to maximize their outcomes and quality of life. So I think this has been great to help others understand this disease. We really want to thank the National Minority Health Association, Mr. Burgess, and your group and what you are doing. Thank you for partnering with the National Pancreas Foundation, and of course, David, who I've known for a long time, and the entire National Pancreas Foundation family. I've known them for their entire existence. I remember, as I said one time, I remember calling the number, and it was the phone in the kitchen of Jane Holt, one of the founding members of the National Pancreas Foundation. And they've come a long way since then, giving scholarships and giving, grants to researchers and investigators to help move the needle forward. Also getting involved with the National Institutes of Health and the Department of Defense and getting funds shifted toward grants on acute pancreatitis, chronic pancreatitis. And so we are very, very happy to continue to be engaged with them and their advocacy. So I want to thank all of you who came tonight on the Zoom call. Spread the word, and feel free to call the National Pancreas Foundation and get pamphlets and flyers that you can use and share with your loved ones, with your community, and in your faith group. So we hope that we have engaged you. We hope that we have educated you, and most of all, we hope that we have empowered you to be an advocate for your family, to be able to take better care of yourself if you have pancreatitis or pancreas cancer, and go seek the resources that you need to maximize your outcomes and give you the best quality of life that you can have. So God bless. Thank you all for being here with us, and have a wonderful evening. Thank you very much.
Thank you.